There's one muscle that's responsible for many different types of back pain and sciatica, and it's so deep that many people don't even know that it exists, let alone how to stretch it. And that muscle is called the Quadratus Lumborum. I'm Dr. Dave Candy, and in this video, I'm going to explain the best Quadratus Lumborum stretch if you have lower back pain, particularly if you have degenerative disc disease or spinal stenosis. I'll share with you a few expert secrets to help make this stretch work even better, plus what to do over the long term to keep your back pain from coming back. Now, if you find this video helpful, hit the share button below this video. At More for Life, our goal is to help people stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. And the more people that see our videos, the more people we can help. So let's get started. The Quadratus Lumborum is a rectangular shaped muscle that runs between your pelvis and your 12th rib. Quadratus means 4, rectangular, and lumborum is your lower back. So it's a rectangular shaped muscle in your lower back. Now the action of that muscle is to pull down on the 12th rib, for example, when you're breathing out. It also bends your spine towards the same side, has a slight pull into extension or backward bending, and also a slight pull into rotating towards the same side of that muscle. Because of that action, it can compress the joints, discs, and nerves on the same side of the spine. The Quadratus Lumborum can also be a source of muscle pain itself. So in order to stretch it, you need to do just the opposite of that. So it bends backwards, you want to bend forward a little bit. It bends to the same side, you want to bend to the other side, and it rotates to the same side, so you want to rotate to the opposite side. Now, there are many different ways to stretch your Quadratus Lumborum, and as long as they're doing some component of bending forwards, bending sideways, and twisting away, they're all pretty good options. But for many people with degenerative disc disease or spinal stenosis, they have trouble getting on the floor or getting back up from the floor to stretch. They may also have pain when they're standing up. And so a sitting stretch I've found works best for many people with various different types of back pain, but especially if you have degenerative disc disease or spinal stenosis. So here's how you do the stretch. You want to raise your arm up and lean away. Its primary component is to pull towards the same side, so you want to do that first. First, stretch away. Now you're going to lean a little bit forwards and then twist a little bit away from that side. And these are kind of fine-tuning motions. So raise the arm up first, twist away, and then lean forwards a little bit and twist sideways and kind of fine-tune there until you feel the best stretch kind of in the lower back underneath the rib cage. Now it does help sometimes to put this opposite arm down towards the floor. That helps fine-tune the rotation motion. And then it also helps to take a deep breath in once you're in this position. Remember, the Quadratus Lumborum attaches to your 12th rib, and so if you take a deep breath in, particularly thinking about breathing into this side of the rib cage, if it's this muscle that's affected, and then breathe in, think about filling your rib cage with air, and when you breathe in, that elevates the rib cage. So it helps stretch the Quadratus Lumborum by elevating the rib cage. Hold that and then breathe out. Now when you breathe out, you use your abdominal muscles to force air outwards. If you also think about at the same time pulling your sternum down towards the opposite hip bone in a motion like this, it activates what's known as your internal obliques. That's a diagonal shaped muscle like this, and that muscle's function is to flex, rotate towards, and side bend towards. So if you activate the internal oblique on the opposite side of the Quadratus Lumborum that you're trying to stretch, that makes that Quadratus Lumborum relax. It's a principle known as reciprocal inhibition, where when you contract one muscle, its opposing muscle reflexively shuts off. So again, you're going to Raise your arm up in the air, lean away first, then start adding your components of forward bending or flexion and rotation. Take a deep breath in. Again, thinking about breathing into this side of the rib cage. Hold that for a few seconds. And then as you breathe out, think about pulling your sternum towards the opposite pelvic bone. That activates the internal obliques on the opposite side, which helps further relax the quadratus lumborum. And then you just repeat that process for a few repetitions. Generally about 5 repetitions is good. So deep breath in, breathe into this side of the rib cage, breathe out, contracting the internal obliques, breathe into this side of the rib cage, and then breathe out. And by the end of doing that, you should feel a good stretch in the side of the quadratus lumborum that's affected. Now, if you have one-sided lower back pain, you want to stretch the quadratus lumborum on that side. But if you have low back pain on both sides, it's probably a good idea to stretch out both sides. Remember, gravity compresses down on you all day long. And if you have degenerative discs in your spine, the space between your discs gets less or less. And that can make the quadratus lumborum on both sides of your spine a little bit shorter. So you may want to try stretching both sides. Now, there is a caveat to that. If you do have leg pain that goes down one side, and when you lean towards that side, that makes your leg pain worse, or when you lean towards that side, it makes the back pain on that side worse, then you only want to go away from the sore side. So if leaning towards the side hurts, you don't want to stretch towards that side, because then you're just further compressing the nerves that are sending pain down the leg. Otherwise, if you have bilateral lower back pain, or if it's stiffer on one side but they both feel a little bit stiff, it's not a bad idea to try stretching one way and then stretching the other way. Now, I mentioned in the beginning that I was going to share what to do long term if you do have a stiff quadratus lumborum in order to keep the pain from coming back in the future. Oftentimes your quadratus lumborum gets stiff on one side because of repetitive or sustained asymmetrical postures. So for example, if you always lean on one side of the couch, or you always lean on one arm, or if you're always standing with your weight on one leg or with one hip shifted out, this is particularly common for women who have children. They're carrying the child on one hip while using their opposite arm. Then you want to avoid doing those asymmetrical postures, because when your hip gets higher on one side, that makes the distance between your rib cage and your pelvis shorter. And if you do that over a sustained period of time, then your muscle gets used to being at that shorter length. And so if you start paying attention to the ways that you sit or the ways that you stand, you may notice that you tend to go one way more than the other. Additionally, because your quadratus lumborum is a muscle that extends your spine, if you tend to stand with a lot of arch in your back, then those muscles in your lower back will tend to get stiff over time. So long term, it comes down to paying attention to your postures and your movement habits that you do day after day after day. It doesn't matter how much you stretch or how often you stretch. Even if you stretch for 1 hour per day, you can't outstretch the other 23 hours in the day that you're sitting, standing, sleeping in those repetitive positions. Now, if you are in the St. Louis area and you need some more help to find the root cause of your back pain, then we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, but you found this video helpful, again, hit the share button below this video and share this with someone else or on your social media so that others can get access to this same helpful information. Thanks for watching, and I'll see you in the next video.